Hello and welcome to LaproFit, India Fights Obesity, and we have Dr. Abhishek from AIG with us, one of the few surgeons who has a fellowship from American College of Surgeons, a fellowship from MBBS, which is the American Society of Metabolic and Bariatric Surgery. He's an American board certified surgeon. So happy to have you here, sir.
Thank you so much.
And welcome to LaproFit.
My pleasure.
Let me start off by understanding, the comorbidities when it comes to obesity, apart from just weight loss. What are the other comorbidities that tend to disappear with bariatric surgery?
So when bariatric surgery came into the picture, bariatric is related to weight. But then later on, with so many years of research, we have realized that it's not only obesity, but there are so many factors which get improved. And I have so many stories to share about my patients, which I never thought that this can change their life. So when it comes to diabetes, I had a patient who was on medication and probably started developing neuropathies, diabetic neuropathies. So he was in a lot of anxiety because he have heard a lot of stories about neuropathies. So when I operated upon him and we did a sleep DJB, which is an advanced version of BPDS, and within 15 days his diabetes improved, things changed, HbA1c improved, and he did not require insulin after that. So he initially, when he came to me, he couldn't believe that this surgery can do miracle. But eventually he started believing, and then whenever he comes to me, I'm so happy. Whenever he comes with some gift or something like that, and sometimes he brings sweets for me, but I strictly say no. So it's not only about diabetes. I have got a few other stories. One of my patient, she was having infertility because of her obesity, and they had tried multiple IVF, IUI methods, but they couldn't conceive. So finally they were referred to me by a gynecologist. I did a bariatric surgery upon her. She lost weight, and without any treatment she conceived. So that's something miracle. I mean, we never expect anyone who already had so many hormonal therapies and other things and conceiving naturally, but that's how nature takes care of it.
All right, there's so much of hope and so much of beauty and the transformation that comes in with bariatric surgery. Let us also understand, there's been a big change that's happening in India. IRDA is now saying, this is no longer cosmetic, we're going to fully reimburse. Your thoughts on that, Dr. Abhishek?
See, the problem is why bariatric surgery is not picking up in India, because it's expensive procedure. So initially people thought because it's a kind of high profile surgery, but it's not high profile. It's the overall expenditure because of instrument, because of hospitalization, because of the risk associated with obesity. So now we are very happy that insurance is understanding the problem which people face because of obesity, and it's not cosmetic, it's a metabolic problems which are very important, and that should be focused upon. So I'm very happy that they are considering it, and I hope they will not keep a lot of commas in between, and they'll be very liberal to help all these people.
All right, let's also understand post-surgery care, the transformation that you're seeing, the transformation in 2020 when it comes to post-surgery care, and what is your center doing to make this happen?
So when I came back from Taiwan after finishing my fellowship, I was the first to start support group meeting in my region, Telangana region. So we usually conduct this meeting because I consider obesity, we shouldn't be taking it lightly. I consider obesity as a kind of cancer. So I learned they do conduct support group meeting for cancer patients to motivate them, to bring hopes back to them. So we started this kind of support group meetings, and we are very successful, and recently we conducted 12th. We usually conduct it after every 3 months. We call all our post-operative patients, new patients who have anxiety, apprehension related to surgery. And patients are the best teacher. They come up with so many ideas. Every individual is different. Everybody's body responds in a different way. Some people do very good, some people don't do good, some people still make mistakes. So that's a kind of place where everyone can meet, they can confess, they can motivate, they can teach other people. So that's the key which is very important.
So happy to know, Dr. Abhishek, you've been part of the transformation that's happening in India. Let me also understand from you, Dr. Abhishek, your call to action for India fights obesity. What is it?
So before insurance came into the picture, that was the first thing in my list. Now since it has come into the picture, the next thing is there's a lot of ambiguity among surgeons and patients. Unfortunately, in India, we were not able to understand what bariatric surgery is, and a lot of people have propagated it as a cosmetic procedure. That was the biggest flaw. So now we want everybody to understand that bariatric surgery is not a cosmetic procedure, it's a life-saving procedure. At the same time, we also want general practitioners, physicians, endocrinologists, and everybody knows that now Diabetes Association, Cardiac Association, they have accepted bariatric surgery as a life-saving procedure. So it's very important that all the physicians should accept it, and they should kind of understand that things can be changed by mutual understanding and collaborative work.
Alright, collaboration is the key to success when
Yes.
it comes to fighting obesity in India. So what's your number one priority in the year 2020, especially when we talk about pre-surgery areas? Anything specific that you'd want to share?
I think being mindful is the most important thing. So whenever a patient walks into my chamber, if they ask for bariatric surgery, first thing I ask them what they're expecting out of me. I don't want them to have any unrealistic expectation. I don't want them to understand that this is a magic surgery. I do the surgery and they can do whatever they want. I tell them you can't buy health, you earn it each and every moment. So you have to be mindful of whatever you're doing. And for that, it's a long process. We do it every day. Being healthy is whatever you do, you have to think about it. And then it comes by practice. So when persons start losing weight, if someone is very mindful, they have a strong cortex, they understand, okay, this was me 1 year back, now I'm changed. There is a group of people who think, wow, I'm good, let's have some soft drink, and this is how it starts. So you should be able to stop that at the very first moment of time. A person with a strong cortex, with a very mindful thinking, they won't do this thing. And that's why here comes the role of support group meeting. We are humans, we are tend to make mistakes, no one is 100% sure. So we try to keep a track of all our patients, we just don't leave them. Sometimes it happens that we keep calling them, sometimes they get irritable. But then I tell them that it's for your own well-being. So they have to come for follow-up. We teach them, we learn from them, and then we tell them what mistakes they can make in future. And some of them confess that, okay, we did this is wrong, and I'm not going to do that. So that's a key.
Wow, being mindful, one of the key reasons for a successful transition. Thank you so much, Dr. Abhishek. It's been a pleasure having you here.
Same
and
here.
we're happy to have someone like you support India fights obesity. Thank you so much.
Thank you so much.